what we're finding is that we have to intervene on these kids early in order to stop this from being an issue as they move into adulthood.
I'm a former Detroit police officer and rode with the One Percenter Motorcycle Club. During that time, I was involved in a lot of altercations. I had a gun shoved in my face. The trigger was pulled, and I got a plate under my left eye. I'm Manny Vitale, and this is my story. How you doing, everybody? I am Manny Vitale, host of My Fight, Our War, and we are back into our second home here in Connecticut. And before we get on with our next guest, definitely want to give a shout out to someone very special that I am very proud to say that My Fight, Our War is in together. We are part of the family as well, and that's with the Brian Cody Brothers and Sisters Foundation with the one and only coach, Tony Morrissey, and his wife, Mimi, and their amazing family. And when I say family, of course, with them, but the extended family throughout not only Connecticut, but around the United States and world. Addiction doesn't care who you are, where you live, what you do. And My Fight, Our War, Brian Cody, Amy, all of our guests who come in here, we're here for one reason, and that's to help. And we all do it in different ways. And the only way that this will happen is just coming together, never giving up. And that's one thing we will never do. So that being said, Amy, welcome. And as everyone knows, I butcher everyone's name, so I'm going to let this start off. Amy, why don't you just tell everybody who you are and where you're from?
And I have a tough one, so I appreciate that. So my name is Amy Beth G. I'm the Director of Health for Housatonic Valley Health District, which is a district that covers New Milford, Washington, Sharon, Southbury, Oxford, and Woodbury in the western part of Connecticut.
Oh, that's all.
Just a few towns.
So, did they tell you that before you took the job?
Yes, I did know. I had a hard time remembering all of the towns in my interview, but I've gotten it down in my past 2 years.
Oh, my God. How long have you been at this position?
So I started in February of 2023, so a little over 2 years now.
Good Lord. Well, with what we do here is we attack this at so many different levels in so many different ways. And everyone brings so many different the ammunition to the table. With what you're doing and your involvement, what exactly is that for not only the Brian Cody Foundation, but dealing with recovery in a whole?
Absolutely. So my approach to being the director for a health district, and I think one of the reasons why we've been really effective in some of the projects that our health district has taken on is public health. One of the tenets that they say all the time is you have to meet people where they are. So when I came in as a health director, a lot of people asked me what was my agenda, what did I want to push on our towns, what was my ideology, and I was reluctant to answer that question because I wasn't sure that it was the right one. What I really wanted to speak to all of my community leaders about, to speak to the community members themselves about, was what they saw as the issues in their own communities and how I, as a health director, could kind of step in and work with them to solve some of the problems that they were experiencing. So fortunately, one of the first people that I was connected with when I stepped into the position was Tony Morrissey. And he is the perfect person, absolutely, to be connected with. So among many of our other initiatives and many of our other health programs that we launched in New Milford, Tony was great to work with for the Opioid Settlement Committee that he and I sit on together. So we have a group of, I believe there are 4 of us now. Recently it moved to 5, so we're really excited to have another member on board. And Tony was great about engaging myself and some members and my staff in some of the programs that he's been running, some of the events he's been running in New Milford for years, like his annual August event, which I was very happy to speak at last year. And I was so happy to see the energy that he brought to the table. He's a pillar in the community. He's so happy to go out there, meet people, always wants to help people. And I love seeing that because a lot of people in the healthcare industry, it beats you down after a while because you're seeing a lot of, people who are sick. You're seeing a lot of people who we want to be able to help, but they're just, they're not there yet in their own lives where they're ready to accept that help. And for a lot of people, that can be draining after a while. I know Tony has been doing this for a long time, and he has not been drained even slightly, it seems. Yeah, he is just phenomenal.
Just this few short time that we've been talking, you two are perfect. I mean, your energy just you could just feel it and sense it. They definitely have the right person with you in this position. You could definitely sense that and tell already. And with you and coach, man, I feel sorry for counsel or anyone that gets in your way. I mean, that is awesome. But the thing is, though, you're right. How with the medical field and the way people look at it sometimes is you just bring up the medical field in general, and it's just like the okay, what hoop do I have to jump through now? You want the help, but you gotta, you're not eligible. You can't do this. How are you helping get through all that?
Absolutely. It can be tough to navigate.
Hmm.
And this is something, I worked in private sector before, and this is something we certainly experienced there too with health. There are a lot of silos. So there are a lot of times when we're all doing the same work, when it comes to hospital systems, when it comes to local providers, when it comes to, some community-based organizations, we're all trying to get to the same outcomes. And a lot of times we're marching in the same direction, but we're not talking to each other when we do it. And that causes a lot of problems because there's so much more that we can do when we're all functioning together and working together. So I think something that Tony has done really well with our group, and our group has done a good job starting to meet a lot of the key players in the community, is we're going out, we're meeting with people, we're meeting with police department, we're meeting with some of the school administrators, we're meeting with just a number of different people who are trying to get to the same goal as we are. And we're doing, I think, a really effective job of making sure we're incorporating everyone's, specific views that they have to make sure that we can be as effective as we can in some of the things that we're bringing to the community.
Man, I tell you, just some of you're so on point about when you have an epidemic or pandemic or something, God forbid, it hits us. At the beginning, everyone, how can I help? Everyone wants to jump in, and when it's something such as whatever, everybody wants to jump in and tell it's a linger. If it's a quick fix, how can I be there of assistance? If it's something like addiction, okay, well, hey, I've been part of this for the last year now. I thought that they could be lasting this long, and you said something about everyone's going in the same direction, but with no communication,
Yeah.
and that is so true because sometimes what I've found is a lot of it is, you get your agenda, and some people, my way is the right way. Well, what about this? No, our way works. Coming together as a community is the best. And sometimes you got to
Absolutely.
put the ego aside, take the blinders off. So by you guys doing that is and involving all the different levels, the council, the police, the hospitals. I mean, you're nailing it. So great job on that. How's that been going? How's that been um, as far as you go and presenting that? How's that been the response from everybody?
So we've had a lot of political support, which is great because
Oh,
it's and I have to say, and I've worked and I have great things to say about all my communities, but with this issue specifically, I've probably worked the most closely with New Milford,
mhm.
because a lot of this work is funded by the opioid settlement dollars, and because unfortunately there was more of an opioid problem, and New Milford is a bigger community than some of our others as well. They received the most amount of opioid settlement dollars, so there was more funding to do this work in that space.
Okay.
Um, I think it can be easy sometimes for politicians, especially when we're talking about. I think it's become less controversial over time, the topic of addiction.
Mhm.
But historically, it wasn't something people wanted to talk about. They wanted to sweep it under the rug. They didn't want to talk about it if it was in their own families. If they had. We all know someone who unfortunately is touched by this, and it wasn't a conversation people were willing to have. What I have seen in New Milford in terms of the ideology from the police department, from our local leaders and our politicians, the town council, is they're very, very supportive of having the tough conversations and making sure that we're using all of our municipal resources in a way that will actually affect the problem in a way that's productive. Um, I think, again, historically, some of the ways that we've fought addiction has been very punitive, right? We are pulling people over for DUI, and they're getting thrown in jail, or they're having whatever consequences are associated with that. We're arresting someone who's maybe intoxicated in public or using in public, and they're having to spend time in jail, and then they get out, and there's really no resources for
Mhm.
them. What I think we've seen to be really effective lately is having things like community resource officers. So there's an individual who works for the New Milford Police Department. That's his title. He's the community resource officer. And the role of his position is really to work more closely with community members, whether it be folks from the homeless population, folks who are struggling with substance use issues, and to make sure he can get them connected with the community services that are out there, so they cannot suffer from some of those negative outcomes and really get some of the help that they need. And it's been really fantastic to see that New Milford has been really forward thinking in that way, because I think it can be a scary adjustment for folks when
It
they
can.
see the data. So many people are unfortunately passing from substance use disorder. There are a lot of, there's this big problem over time, and they're more likely, I think, historically to come at it from a disciplinary perspective than a how can I reach out my hand and help you perspective. But we're seeing that
Oh
switch.
God, yeah. And the thing is, as a former police officer, especially like Detroit, where violence and drugs, it's everywhere, but Detroit, and you see these people, and when it's involving drugs, alcohol, the people that are not affected personally, they're like, well, we want them off the streets and just the letter of the law, and just lock them up, lock them up. That's the key to everything. Lock them up. Well, and just like in my personal feelings, no matter what it is, if you're gonna lock someone up, okay, they got the crime, the punishment, okay, but do something positive.
Absolutely.
Get something in there, like the resources for education about the drinking, about drugs, about domestic violence, whatever that they're locked up for. Don't just they just need to be off the streets away from the public. Well, yeah, you know what? You're right. They do at that point, but do something, and that's why so his position as officer, that's as far as that's his only position is dealing with no matter if it's like domestic, drugs, whatever it is, and he does a follow-up, or how does that
He
go
does
again?
follow up, and he is very hands-on with the community.
Okay.
He'll go out, and if he sees, an individual who may be homeless, who's walking around, he'll make sure they have a ride to the seniors or to the homeless center rather. He'll pick them up right in his car and drive them over.
So
So
instead of the usual protocol, loitering, trespass, to jail.
yes,
So,
exactly,
how
exactly.
long has that been in play?
It's been ever since I've gotten there for
Oh.
sure, and I think before my time. So it's been in place for a few years now.
And another thing, I can't remember. I know that Coach, like I said, the work that you have been doing is just awesome. And Coach, believe me, I mean, I don't. Everyone is so appreciative of it. Was his situation? Obviously, he was on the show and told the story. So I'm not going off. I'm not going crossing any lines here.
Mm.
Things could have been different if the law enforcement, and I'm talking as a former officer too, where there's protocol. And if things would have been handled differently, who knows? We can't live by that because it'll eat you up inside. But when he told me about the protocol where with Brian, not only was visibly impaired, but verbally said, I'm going to hurt myself, or I'm afraid I'm going to hurt myself, and all these things that happened, the system failed him. And God bless Coach and you for making sure that this doesn't happen, because people have to remember that when you see these homeless people, when you see the drug addict, the alcoholic staggering around, just remember they're people,
Absolutely.
and they were people before the addiction and the alcohol, and they're people in recovery, and they're the same people, and that's the big thing because they said, "Oh, you're such a better person now." I was a person before, and I'm still a person. Um, Now this opioid, the funding and all that, I obviously have heard about it. How is that affecting you guys, and what does it do? What are the benefits that are gonna be gained?
So, the good thing about because of some of the political climate that's going on right now, these dollars are not at risk of being seized because they're
Mm,
granted, but they're not granted in the sense that they're coming from the taxpayer. They're granted in the sense that they're coming from settlements with some of the pharmaceutical companies who were responsible for the opioid issue that we're still dealing with today. So because of that, it's a great opportunity to receive some of those funds and think about what we can really do to counteract some of the negative results or some of the negative effects, I guess, that we've seen directly in our community associated with the opioid crisis. Um, I think what we can do is when it comes to so public health is a prevention science, and that's what I have my background in. It can be tough for some people to kind of wrap their heads around public health because although we have a lot of data that we can always share, a lot of our work is preventative. So the data is hard to collect on things that we've prevented because they don't happen.
Exactly.
So what we can do is focus on things like making sure people have Narcan. So one of our initiatives for the opioid settlement committee in New Milford was to do hope kits, which Tony or Mark
Oh,
may have
yes.
mentioned. So we collected with some of the dollars we put together these backpacks, and what the backpacks have in them, they have Narcan kits in them. They have safe use kits. So harm reduction is a big part of what we do as well. So we can't always prevent people who are going to use from using.
Hmm.
We want to, we do the best we can. But at the end of the day, if someone is going to use their inactive addiction, it's hard to prevent that. So we want to make sure that they're using in the best way that safest way that they can. So there are fentanyl test strips in there. There are xylazine test strips in there. There are some blankets, some safety kits, Band-Aids, things like that if they're suffering from any kind of, physical issues with their body. And what we also put in, and I think this is really important, are both resources and kind of feel good items. So in each kit, we put a bracelet with a quote on it. It can be, it's you're special, you're important, you're enough. Those are some of the quotes that we have on the bracelets because sometimes that's what people need to hear.
Oh my God.
And resilience is so important. And if we can make sure that the message we're sending to these folks is we're here, we care about you, we want you to stay with us, and you are important. How can we help you to overcome this? That's really what we want to be sharing with folks in our community.
Oh my God. I tell you, Amy, this one thing that I have got no background in social media or hosting shows. I don't know. I've never taken classes as far as a counselor, a drug counselor, a coach, anything like that at all. I always said when I first started my fight, I'm one of you. I will not ever talk at you. I will talk, or with you and all these things. And one of the things I always say is our words are so important and to be so careful how you use them because they could be the
Mhm.
most wonderful things that you could do to take us to the highest of highs. But if you're not careful, the words that you use on people at a certain time, you could destroy them.
Absolutely.
Being told that you're enough, as silly as that might sound to someone who doesn't understand the addiction and opioids and the fentanyl and all that, you are loved, community, family, or just the words like that, just to look down and see family. Stuff like that that might seem pointless to some people in that bag, along with a test strip to people that might say you're being a hypocrite or you're anti-drugs, but you're giving them stuff so they could use drugs. No, we're doing it the safest way, which is
Exactly.
so commendable. And if you're good, like you said, we want you here until you can get better. That's just awesome. With the growth with, I mean, the opioid, I mean, you don't have to be, unless you're living under a rock. Uh, what have you seen in like the Connecticut area, the New Milford area? Coach, when I heard his story, not only Brian, 12 people, not only just 12 kids, but 12 that Coach was like, they were at my house. How could this small community not know? And sometimes, like you said, blind eye under the rug.
Absolutely.
So with your awareness and all that, the community involvement besides the political and police and all that, the citizens, how are they being involved?
Sure. So it's been very well received, which is great. And what we're seeing now, and I think time will tell in terms of some of the data and trends,
Mhm.
the state of Connecticut has put together a really good dashboard, which shows us for each region in Connecticut, it's even you can drill down by each town in Connecticut, what the impact of opioids has been. How many people in each town have overdosed in the past year and unfortunately passed as a result of that overdose. And based on a lot of that data, what we're seeing is there was a big problem, as we know. I think the data, the dashboard starts in 2015. COVID was a big factor in terms of people using, starting to use, continuing to use, just because of that isolation
Yes.
component was very difficult for people. And fortunately, what we're seeing in the last year, the last 2 years, is that rates have decreased.
Okay.
It's, I think, kind of yet to be seen why that's the case. There are still overdoses that are occurring. Overdose deaths have dropped a little bit. So is it that we're getting Narcan into people's hands? That I think might be a big
Mhm.
factor. Are there, additional social supports that people are getting maybe? Sure. And I think there's a little bit less isolation like there was happening during COVID.
Oh,
But
yeah.
I mean, these numbers have fluctuated year over year, so that we can't really take that win on the chin here yet because we know this is still an issue. This is still something that we're combating, and it's going to be something that we're combating, over time. Um, in speaking with a couple of the folks from the school systems that we've been having conversations with more recently, what we're finding is that we have to intervene on these kids early in order to stop this from being an issue as they move into adulthood. High school is not early enough. By the time you're 14, you're already involved with, friends who may be doing some of these substances that, either you're on board with or you may not be comfortable with, but maybe you're being peer pressured into that. And we know some of the negative outcomes there. So we really need to make sure that the interventions that we're bringing to the communities are happening when the kids are in late elementary school or even into middle school. Um, and there's a lot of different things I think that come into play when we're focusing on what do we want to do to intervene on these kids that are that age and how can we make those interventions effective. Um, some really good information that some of the folks in New Milford, the youth agency, New Milford Can, which is a local group, the local prevention council for the town of New Milford, they do a survey every couple of years. And what they found from that survey is that there are a few different constructs that they find in children's lives that prevent things like substance abuse later on. And we know from surveys that are done on the national level, there's this thing called adverse childhood events. And what happens in some of those surveys, the questions that they ask are, do you experience anything like physical abuse in your home? Do you have a two parent household? Do you have a parent that yells at you frequently? Are you experiencing that type of abuse? Do you have a parent that uses substances? Do your parents have two jobs? Or does your parent have a job and they have found employment has never been an issue for them? Do you have enough food to eat every day? And we found that asking questions like this does really do a good job of identifying youth who may be most at risk. And also working with folks like the youth agency, working with social services, working with people in the school systems. They know the kids they're working with every day.
Mhm.
So we can also kind of pinpoint children who may be most at risk that they see. And then based off of that information that we have, how can we get those kids involved in whether it be an after school activity, whether it be a volunteer program? How can we make sure that we're providing some of the resources that they need to avoid some of those negative health outcomes or those negative substance outcomes because we are meeting them where they are and we're able to provide them with some of those resilience factors that they need in their life.
Man, I tell you, I have some family cousins that are teachers, and of some of our conversations, you talk about the kids, and I remember back when a lifetime ago when I was in kids at school, that it was high school.
Mm,
They'd come in, and back then it was like I think Mad and I don't know whatever it was, but we're high school, and they're talking about just say no and drugs and all that, and now. I mean, me as like I said, as an officer in EMT, and just being out on the street, it's like you nailed it. High school, you're done. Junior high, middle school, grade school, and we were having a conversation one time, and I made a comment, kind of jokingly, about preschool, and people started laughing, and I wasn't laughing. I'm just like, and I go, well, you know what? You look at a child, they can. How old are when they start? I don't know any of this stuff. I'm not a teacher or anything like that. When they can like learn, comprehend things in their own way. And obviously, you're not going to walk in with a syringe to a preschool kid and don't do. But and I was damn serious about this. I go, don't say you can't. I don't want to hear I can't or
mm,
you won't work or this. Did we tried anything? And again, it was, is there a way for the youngest of the young that somehow use stuffed animals, toy, or whatever it takes to show them how? Because starting early is the key, man. And just the teachers, like you said, and educators, they see our kids every day and the decline. And that list that you just rattled off, as we know, that should be yes to all those answers. Yes, I have two parents. Yes, they have jobs. Yes, I have food. Yes, life is wonderful. Unfortunately, that's not how it goes.
Absolutely.
Um, and by defining that, some people say, well, that's just an excuse, for people that do use, well, but it's not an excuse. And these factors have to be taken in, you know, is and with your personal, what you've been dealing with, what are some of the youngest, like I know for myself, I remember seeing these kids that were what they 5th grade, sitting there talking to me about smoking crack,
Yeah.
5th grade. And then other ones, it's just like, just to say those words as a 5th grader, I'm like, what have you either like for parents or yourself, what's the earliest that you've ever heard or encountered?
I think, you hit it. It's 5th grade, probably like 10,
It's just like
10,
that.
11. Unfortunately, is the time where kids start to have those conversations. Maybe they have an older sibling, maybe they have some older
Yes.
friends that are experimenting. And really, I think it's important to take a step back and think about what incentivizes kids to either think about using or start using at
Mhm.
that age. And I think it's probably not some of the reasons that we're seeing in high school as much, although it
Mhm.
may be some of those reasons. I think it's peer pressure. So,
Oh,
what they're hearing from the fellow kids that are in their class or their siblings. And then the other is mental health. And I think that's been a
oh yeah.
conversation that people are really reluctant to have too, especially in public school systems. People are, wanna step back from that a little bit. Something that we've started to roll out more recently, and my, public health nurse is doing this right now, and she's doing a phenomenal job. There's this book called, Gizmo, and it's about, a dog, so automatically you've pulled me in, but I think you've
I,
pulled a lot of kids in too. And it teaches about, emotional health, how to manage emotions, and mental health, and how you can overcome some of the, if you're sad about something, how you can acknowledge that feeling and deal with the feeling in a healthy way. If you're mad about something, how you can deal with that in a healthy way. And I think teaching that emotional intelligence to children who are that age prevents people who are gonna use a little bit later on from because they're trying to run away from a feeling. No one likes feeling sad. No one likes feeling scared or mad. So sometimes people use to prevent those emotions from coming up. But if you have kind of the know-how and it's been ingrained in you how to deal with them, how to sit with them, how to realize they're not permanent and kind of let them go in a bit of a healthier way, I think that can be useful for children as well.
man, yeah, and just kids can be so ruthless and
Absolutely.
so mean. And we were joking with some friends about, man, if I could go back in time, I'd love to be. It was like I would not want to go back again. The kids, the things that they're facing
Mm.
nowadays
And
with the
social
drugs
media.
and media, just. I mean, back when I was young, being a kid, man, going outside playing baseball, just riding a bike. We didn't have the iPads and the phones and all that stuff. And now that's another thing too. You've got so much access to social media and the younger and me, I have a hard time turning on my iPhone, try hear my goddaughter, she was, I think, 8 at the time, "Uncle Manny," and she's like, done, just reprogramming the thing, and it's like, that was so neat, but at the same time, like, you can get anything over the internet and the
For sure.
information and all that, and, as far as the education and stuff, it has to get out there as soon as possible, and, just I think there's so much that you said as far as working together as a community, and just there's so much that goes along with it too. The violence and the stuff that happens that the kids are exposed to, and it has to be talked about because you're right, it's being swept under the rug because no one wants to be. And I have talked to parents who break down and they're like, "What did I do? How did I fail? How?" Wait, no, you didn't fail. This is something happened to your child or your loved one. We need to come together now and work on this, but we're not working on it by ignoring it. And that's why what you're doing is so commendable. How is this branching out to other communities or other cities, states? Is that going or?
So what because we're so I think, Connecticut's a small state.
Uh huh.
It's not a huge state. And I think we work really effectively across town lines. Every time I'm at a meeting, whether it's a local prevention council for another community, or it's a meeting with Western Connecticut Prevention Council, who does a really great job bringing folks together around this issue, I'm always learning because there are always new groups that are coming up that are getting funding to do some other really cool things in the state. So something that I heard recently from a group that is up in Litchfield County is one of their programs is when someone either calls the cops or ambulance is called to someone's home because someone's experienced an overdose.
Hmm.
What they'll do is they'll return the next day, and instead of returning, as a cop and saying, "Hey, you're in trouble now," is they'll speak with the person and they'll say, "Are you okay? What happened here? How can we help you? I wanna make sure that this doesn't happen again because we don't wanna lose you." And they'll provide them with Narcan. They'll have a conversation with them, kind of try to understand what's going on in their life that is, driving them to use or what's gone on in the past that has kind of embedded this as a routine for them, and they'll work with them to make sure, as best they can direct them into a program or direct them into, a group of resources that can help them.
Is that the officer that you were talking about?
So he does some work like this.
Uh,
The group that I had met is a group in Litchfield County
oh,
that has
different.
a specific program that focuses on this. This
Okay.
is something Jake, who's the resource officer, may be doing something similar to this, but I would love to have this conversation with him as well because I think that's such a valuable opportunity to speak with folks right after, unfortunately, they've overdosed and really have that. You're not in trouble.
That's the
I
first
want to
thing.
help. What's going on?
You see that car pull up, especially after an overdose. The first
Hmm.
thing is, well, like you said, I'm in trouble. I'm in trouble. How do I get out of this? So it's so important to, you see, I encountered it. I'd walk up, they'd see a police uniform, and a lot of it, unfortunately, too, was these poor kids, the family dynamic. I remember standing there and the parents saying, don't talk to the police. The police are bad. Police take your family to jail. And so these are all these different obstacles. But to get that intervention where, police are just people too. I mean, the people who are coming to, we are there for a reason. It's not because we enjoy, taking people to jail or breaking up families. We don't enjoy making that call that your loved one's dead. We don't enjoy going to the morgue. And it's very heartfelt. Um, but to get that community, that bond where, like you said, "Are you okay?" When that door opens, instead of, "Excuse me, John Smith, yes, can you come with me?" Boom. "Oh, hey, John Smith, yeah. Hey, how you doing, man? You got time? Can I talk? I'm just worried about you." Just that
Absolutely.
a conversation that could be so simple can save a life, and, that's just what we have to, focus on as well. And another thing that I talk about with that I learn all the time doing this show and talking to people is when I first started my fight our war, I had not a clue. I just was blurting stuff out. Sometimes they're like, "Manny, you can record. You don't have to go live all the time." And I'm like, "No, that's what I do. I screw up and I fix it and I whatever." But it's like we are here for people with any type of addiction, and that was supposed to be it. And all of a sudden, I said, or any type of mental health issues, anything at all, anything that it doesn't need a title or a diagnosis to ruin your life.
Yeah.
And afterwards, they're like, "Where'd you come up with that?" And I'm like, "What?" And I didn't even realize I said it. It kind of fit together because it goes hand in hand with mental health issues, depression, drugs,
Yeah.
the family dynamic. Have you seen anything with you're dealing now with mental health issues, as well as addiction? How do you guys deal with that, or is it kind of the same way?
So it's interesting. And actually, I heard this, and this is not personal experience, but I heard about a study the other day, and this was so impactful to me. So there were a group of scientists, and this was probably, in the 1950s or something like that. It happened a long time ago. And they did a study with rats. And the study had the rats in the cage. I think they were all in their individual cages, and there were two bottles of water. One was just normal water, and the other was water with morphine in it. And the scientists hypothesized that, we're all animals. What will happen is drugs are just so addictive that once the rats understand that there's morphine in that water, they're going to ignore that other water and they're just going to go morphine, morphine, morphine until unfortunately they overdose. That was the focus of the study. That
Mhm.
was the outcome of the study. And they said, see, that just proved our point. Another scientist came along and he said, well, I don't know that you're totally getting the full picture of the story. So we're going to do something a little bit different. He put a number of different rats in a cage together. He put the two water bottles, one with just normal water, one with water with morphine. And then he put toys in there and he put other activities. He put a little wheel. He put things for the rats to do. And what he found was the rats were not so incentivized to go just for the morphine. They were playing with the other rats. They were playing with the other toys that were in the cage. They were doing other things. So, what that tells us is that mental health, or what I drew from this anyway,
Mhm.
is that mental health, isolation, social relationships are so directly correlated to if folks become addicted to substances or if we have some of those other resilient factors in our lives that can maybe lead us in a different direction. Some of the having the other rats in the cage, being able to build those social
Mhm.
relationships, being able to do something else and not just kind of in a depression where you're by yourself, where you're isolated, is really protective against some of those negative outcomes. So I personally think, and I have to say, unfortunately, I do have some addiction in my family. And what I've seen personally with some friends that I know have suffered from substance use issues as well, mental health is such a huge component when we're having this conversation. And I think definitely historically it had not been the focus of the conversation at all. People were just um, very negative in the way they spoke about addicts and, this and that. And it was just very black and white. And
Mhm.
we're seeing there's so much more to the story.
Man.
So that's really what I think we have to focus on moving forward. We're doing a much better job of it, but it's identifying kids maybe who are at risk of some of those mental health issues, focusing on providing some of those constructs for them, and then seeing some of those better outcomes over time.
Man, I tell you, you nailed it with as you were telling this, I'm picturing, uh, everything, and it just makes sense. If you get, a couple rats or 2 rats, whatever it is, and you give them 2 options, okay. So there, I was right. Well, wait a minute. I love that outside the box thinking too. Hold on. Let's do this, this, this. So you got the interaction and the different activities. So now, because before you've got one thing you're focusing on, this and this, and that's it. So that just proves it right there as well. And the interaction and choices. I had, but the mental health issue was something that I've always thought on as well. One of my guests today said she had ADHD and just never was diagnosed.
Mm,
And she said, but people would look at it like, oh, it's no big deal. It's nothing. It's just like anxiety or depression. Not, it's not like cancer. It's like, what you? But again, it's like you got to understand it. She said, here I am fighting these demons of addiction, but
absolutely.
I'm also fighting as a young child this other disease, this mental health issues that she battled her whole life as well. And, and again, I just love this because it was another thing I didn't even think of. And, but you are so right about us as a whole. It's just like, well, they're a drug addict. Just lock them up. It's like that's all there is, and this is why. Well, what if it's not? And the thing is, we are all affected in this directly or indirectly. And some people, that's like people were thanking me for doing this stuff, and I thank everybody that's involved in it. And I still crack up when I see these people who are counselor who go to school and get their degrees and drug counseling or alcohol, whatever the title is, for and have never had issues themselves or like
Mm,
family dynamics where they've had it, but they want to help. And it's like, Wait a minute. You wanna deal with a bunch of drunks and addicts, and you've never felt it firsthand. God bless you, man.
Yeah.
Um, and it's just to do that you said that you've had it, issues firsthand. Well, family-wise. Anything that you would like to share as far as, how that may have affected you and your thinking first as a family member, but then as this position and this amazing job you're doing?
For sure. So, unfortunately, alcoholism
Mm,
runs in my family. My grandmother, who had, a very difficult life of her own. So she was born in a section of Austria, and she lived there with her family during World War II when she was very young. Unfortunately, when the Nazis came in, they took over her town. They kicked everyone out of her town. The section she was in, it was called Kachea, and a number of them moved to Queens, New York. We're seeing that that community doesn't exist anymore. It's great that they have some folks that exist in Queens, New York. We were reading a book, actually, that she had given us recently, and it showed the population of Kacheans over time, and it's just gone down and down and down over the years because, unfortunately, once they were kicked out of their town, it didn't exist anymore. So she had a really hard upbringing, and her father was an alcoholic. So that was very difficult for her to deal with. I think she was 13 when she and her sister came over to America. They had nothing. They came over on a boat together. She began being a nanny, I think, for a family, and then she met my grandfather, who was in the Navy, and they lived the American dream to some
mhm.
extent because they really kind of picked themselves up by their bootstraps. And my grandfather was very brilliant. Became an engineer for a hospital, and they lived a very nice life. I think sometimes, and unfortunately, and we're still seeing this with her, she's 94 years old. The woman is just incredible. She's still
Wow.
as active as anything. She's an amazing person. Um, but I think because she had overcome so much, she wasn't as open to some of the problems that people could experience in their own
Mm,
lives, and she was maybe more just kind of ignore the issues. I've certainly been through a lot myself,
mhm.
So, unfortunately, her son, who is my uncle, had a big problem with alcohol use, and unfortunately, he passed away due to
Because of
his use of alcohol when he was fairly young. I think he was in his 50s,
mm,
um, because of a lot of his issues, with alcohol. And this is tough too, right? He was such a social guy. He knew everyone in the town that they lived in. So he would get pulled over by cops that he knew, and they would just say, "Go ahead.
it's okay.
Don't worry about it. Don't do it again, but we're not going
Mhm,
to get you in trouble or anything." So it's tough because not only did they not hold him accountable from a punitive perspective, but they didn't say, "Hey, buddy, this is the third time we've seen you do this. Let's maybe get you into a program. Let's think about how we can help you." Um, so that was tough. And then my father has struggled with some alcohol use issues of his own, and so kind of seeing that firsthand throughout my life has been tough as well. Um, so, I don't know that there's always a good answer because I'm doing a lot of work in the community,
mhm.
with this, but then, you go back and you're looking at your own family and you're like, sometimes we try to help and, you can do the best you can, but people aren't as open as we would like them to be for certain things. Um, so I think there are definitely a lot of, different factors that come into the equation, but being supportive of people in our lives, making sure that it's funny because I've said, my heart goes out so much to people who suffer with substance use issues, but then when it's people I know directly, I'm a little tougher with them.
Isn't that insane?
And it's
But
it's
it's true.
yes, absolutely, and I'm like, "I know that's wrong," and it's hard to overcome. But I think as much as even saying, "I love you," I'm here for you. If you need anything, let me know. You can't get frustrated. You have to say, there's a reason that you're going through what you're doing, and I want to be here for you. And, so that's what I've seen to kind of be effective in my own life. But I think dealing with a lot of that, especially with my uncle when I was younger. When I was 10 years old, I can remember things unfortunately happening with my uncle because of his use of alcohol. So that definitely shaped me and in a lot of ways pushed me into a field where I wanted to feel like I could help others with this issue as well.
Yeah, I tell you, when it comes to family, sometimes people use that for an excuse for their drinking. Well, hey, it's in my DNA. It's not my fault. All of our family drank, and that's how my family is. I mean, the big, all of us were aunts, uncles, all of us. And I was talking to some friends and just looking at some pictures because my childhood, I love when people say, "Well, you had a normal childhood." What is normal? I
Yeah,
mean,
absolutely.
and I say, my dad divorced very young when I was very young. My dad was extremely violent, verbally, physically, emotionally.
Mm.
A lot of stuff going on there. But aside from that, I was surrounded by love with the family. And we were sitting there looking at some old pictures, and from my first birthday, there's me with the cake and all that, and family everywhere, smiles everywhere, all of the family together. And I'm like, wait a minute. I'm looking at the picture, the table full beer bottles, full of VO shot glasses, ashtrays overflowing, but it was just acceptable. That's how it was.
Absolutely.
I'm old, or I'm 59, but seeing all this, every party, every social gathering, by the time you walked into the door, you were either greeted with a handshake, hug, and a beer. Then afterwards, it was like, "Want a shot?" And then we were sitting the whole. That's what we grew up with. And then it was the, "Can I have a sip of your beer, uncle?" Well, of course, just a sip. You're 6. And all this growing up with it. But you are so right about the us in this field now. And other people, it's like you can get through this, and it's still the tough love when needed. But yeah, you're right with our family. It's just like
It's
I've
harder
had people say,
sometimes. Yeah.
would you say this to someone else?" No, but it does affect us different ways. Do you think by seeing that with your family, did that have a positive effect on you not to get sucked in that way?
For sure. And I
Mm,
think, especially coming into kind of like young adulthood, right? Like after, going through high school and after college, I realized that a lot of people in my family, and again, going back to the mental health thing,
mhm,
have issues with substances because of their mental health. And I
mm.
can see it right, like almost in every member of my family, especially on one side of the family. And I think that that was really a big reason why they struggle. So I suffered from anxiety for a long time. I can pinpoint even like things back when I was like 3 years old where I'm like, that is not normal. That is an anxious child. I definitely had the just I know I was an anxious child. So I think just kind of the ideology of everyone at the time was you don't want to put kids on medication. You don't want to, start kids on that. It's a crutch, like
Mhm.
it's not the right solution. But by the time I was going into college, I was like, no, I think this is a problem for me. I think I need to talk to someone about this and, maybe get some help. And when I was talking with my psychiatrist, and I was seeing a therapist at the time,
Mhm.
um, and I was like, I struggle with this. I want to be, tough. I want to feel like I can do things on my own. I don't know that I want to be medicated, but I really think it might be the right thing. And the person I was speaking to was like, you're so silly for thinking that you can overcome everything by yourself. You can't just be so tough. We all need help.
Yes.
And she was like, it's like trying to dig a 6-foot hole with one of those little garden trowels from your garden. She's like, no, you need everything working for you so you can be able to be the best person that you can be. And, we all suffer from different things, but if we can set ourselves up to, function at our best, we got to do that. So it was really helpful to me that she had spoken to me about that. And I think that in conjunction with, feeling a little bit better about, taking medication for anxiety and,
Mhm.
and stuff like that set me up to not fall into, unfortunately, some of the patterns that folks in my
So
family
instead
fell
of
into.
self-medicating, but that is
Yes,
so
absolutely.
true. And like, and a lot of times it's a macho thing, with guys. I
For
don't need
sure.
help. You can, or it'll be, "You're fine. Here, have a beer or have a drink. You'll feel better." And I can't even tell you how many times I heard that. "Just take it easy. Here, have a drink." Um, but that thing about getting help, and when you sit back sometimes, like for me, looking at the big picture, the help is here. You know, you just have to ask for it. But then again, I hate it when I hear and see this when someone does reach out and the system fails because they turn around and look at the whole entire system everywhere, where it may have been a breakdown on one person's like issue who
Yeah.
maybe had a bad day or did the wrong type of procedure, and that happens. But I love what she said of we all need help, and we do. Uh, it, like I know with me growing up, we all drank. I mean, the group I hung out with, it was hard to talk about even like getting older, like late teens, 20s, 30s, because we were all drinking together and we were all drinking too much. So none of us were going to say anything to each other. With you and your personal situation, did you ever? Because my best friend, he was like my brother, Jerry. God bless you. I've known since fourth grade, fifth grade, and I actually climbed into his hospital bed and held him as he died in my arms and took his
Mm,
last breath from multiple organ failure because of drinking. And but we all were together, so we're looking at this like it's not well. He drinks as much as we do,
yeah.
so it's acceptable, which was so crazy because I remember that day, and we were all at the bed, and I looked at my guys, all of us, and I said, "What a terrible way to die." Just watching him, and he only lasted about 12 days in the hospital.
Oh,
Fast forward, I'll have to tell you my story one time, but I was hospitalized for 30 days for multi organ failure. My kidneys, liver, and pancreas all shut down. I was yellow as can be, had to say goodbye to my family, and hospice took over. And I had to say goodbye. And I'm still here. And that's because they my they took some blood to give to hospice, and there was movement in the levels, which they knew was
mm.
impossible because they've all shut down. The next thing you know, specialists are coming into my room and they're doing all this. But long story short, here, I'm dying from the same thing that I held my friend, thinking what terrible way to die. By the grace of God, I'm still here. But, just growing up and seeing this, did you ever have an issue like with any of your close friends that affected you that maybe have also touched you in this way that's so much more passionate for this reason?
For sure, and, it's tough because I'm still, although feels less and less every day, I'm still young. So, um, certainly, in college, you have the friends who are
Mhm.
maybe drinking a little bit too much, and then you come out of college and people kinda stay in that habit of drinking, and, we do have a few friends now that we've identified, "You're drinking too much," and we talk to them, we try to have those conversations. You can still see some of the negative effects, and, it's really tough to try to, talk to people that you've known for so many years.
I was just gonna say for you, because now these are my friends I've known forever,
Yes.
but you're Amy and the health director for addiction and all that. So are you getting hit with, I'm not one of your work projects, I'm your friend, just do that?
Yes, and probably the worst that I've heard from both friends and family on this is "You're not a doctor," is what I get back when I'm trying to say that, and I'm like, "I know,
No,
I'm
I'm
not
your
trying to be a
friend
doctor."
and I love
Exactly,
you.
I'm your friend. So I definitely try to take off, the professional hat
Mhm,
and take on the friend hat when I have those conversations because it just leads to too much
mhm.
back and forth if I start bringing data into it. People are like, "I don't wanna hear that right now, Amy, thank you." But it can just be so tough, and, my mom always said when I was growing up, and I think because she had seen addiction so much in our family, she's like, "No one chooses to be an alcoholic," no one gets into this, has their first beer and says, "I'm committing to this. This is what I want my life to
Mm.
turn out as." It just happens. And, whether it's, you get in the habit of it, whether you're upset, whether you're depressed, it happens after a while. So, it's when I've seeing it and I'm still seeing it with some of my friends, it's really difficult, because we are still younger and they're experiencing health problems that you should not be experiencing when you're in your early 30s. Um, so it's trying to, again, show up for them, be there for them, and say, "I don't want this to end your life. I don't wanna see
God,
that happen
it's
for you."
so hard when, you're dealing with family and friends, in that situation because, like you said, you're not a doctor. No, and I don't play one on TV, but I am someone who cares about you, and I do see this every day, and I don't want you to be a statistic. I don't wanna come to your funeral. And like what you said about, this choice, like, I tell people about addiction, this isn't something that we plan. Like, you nailed it, Amy. I had a show, and I was sitting there going, "Today, my to-do list, I woke up, have breakfast, go to the gym, take, the garbage up, do this. Oh, shoot, wait a minute, before that, I forgot. Today's the day I become an addict. I forgot that. I gotta go back now." No, it's not on our to-do list.
Yep,
However, we made some choices and decisions that put us into this. And, as family and friends, we gotta do our best to try to figure out how to help. And again, us as ourselves, once you get on that path, I'm like, just please don't set yourself up unrealistically. Don't set yourself up for failure. And that's what, with all these different organizations and all the different programs that are out there, there are so many, like you said, but it still doesn't seem like there's enough.
absolutely.
Um, like getting the word out there and just getting the acceptance, because sometimes people just like, this isn't a problem. Well, yes, it is, and the more people that hear it, the better. It's just, what we do is, it's a very hard thing to do, and I commend everyone for doing it. What are your short-term goals right now that you've got going on compared to some of the longer things that you and Coach and your amazing team are doing?
Absolutely. So, I think we talked about some of the initiatives that we've had approved by the town council.
Yeah.
So they're rocking and rolling right now. So we have the Hope Kits initiative that we launched with the Narcan kits.
Mhm.
We have an initiative where we gave some funding to the police department for some training on dealing with folks who have substance use disorder and how they can show up when they meet them
Didn't
in
they
the
change,
community.
or there was something you guys did that changed a law about the police? Coach was saying something, but I can't remember what it was, but it was something that you, because of you.
So it might be the training that he's speaking about. So making sure that these law enforcement officers are receiving this training.
Mm,
And that's just, I think, fabulous because that's not something that's, been ingrained
mhm,
in their training, as
mhm.
they move forward in their careers. So that's something that we focused on. Also, Tony may have spoken about the legacy fund,
Oh,
where
yes.
we have
The
funding for,
scholarships.
unfortunately, people who have lost a family member, how they can receive some of that funding to bury their family member and some of those
Oh,
costs
no,
that
I
we
didn't
may
know
not
about this.
predict. So I think that's very important too. And then one of the initiatives that my office is working on right now is mental health first aid training. So we always hear about first aid training, CPR, things
Mhm.
like that, right? This is actually how to identify people who may be struggling. The model is train the trainer. So we have three folks, the community resource officer in the police department that I mentioned, my public
Mhm.
health nurse, who's phenomenal, and then someone from the youth agency
That
as
was
well.
Heidi.
Heidi,
Heidi, you're
yes.
gonna be on
Shout
here.
out to Heidi. Yes, absolutely. So the three of them are currently being trained to deliver this mental health first aid, and then they'll be able to train people in the community, whether it be folks from the schools who we really are looking to engage, just parents in the community, to then deliver this training to children in the community and to other folks for how to identify someone who may be suffering with a mental health
That
problem.
was what I was gonna ask now, is how
Yes.
is that what the training is basically doing, is just by their words and actions to say, somebody here, we might have something going on with this individual,
Exactly.
instead of being diagnosed with, whatever it is, it may be mental health issues and being missed.
Exactly, and how you can step in and have that conversation
Yeah.
just as a layperson, because a lot of people don't, they're not familiar with this topic. They don't know how to speak to
Mhm.
someone about issues that may be going on around this topic. So, how can every single person hold themselves accountable for being able to impact someone's life by having that conversation if they see something? So I think that's really fantastic. So that's some of the stuff that we've already gotten funding for that's in motion, which is great. Now we're coming into some of the preventive work. So that Gizmo program with the
Mhm.
book
The
about the
dog.
dog, which is awesome, and some of the work in the school systems. We're tying it perhaps to truancy. So we're seeing when children who miss school, maybe it's because a single parent home, mom has a job, and the younger brother is sick. they're the caregiver that's responsible for staying home for that younger child. And when that's happening over and over, the kids who are staying home for that reason, staying home for other reasons because they have to kind of act as a parent in the household, that can be correlated for substance use down the road. So how can we focus on some of those kids and get them into some of our programming for either volunteer after school programs, stuff like that. So that's some of the stuff that we have coming up. And then just getting out and talking to more and more and more people in the community, so we can learn what they think they need, what we think they need, and how we
Mhm.
can come together to launch some of those programs.
See, everything as needed, and I always think, for me, there's more I need to do, and there's more we all need to do. Um, but at least you're doing something. But the biggest thing is, of course, the community with law and the politics, the council, and all that. But the city involvement, the civilians, the public, the moms, the dads, the teachers, the people who are with our kids, and not only just the kids, but just our community. And you nailed it. Community involvement is because so many people feel totally abandoned, and some of them are. Some of them by family, by their own flesh and blood, because they're just, and it might be because of mental health or whatever the issue is, but still. And then all of a sudden, like I say, you get the situations where the system does. No one's perfect. No system, no people or system is perfect. There's flaws, but to always have like a backup, or like your father. I love what you said about the day after, when you have that person who does come home after, it's, you're not going to jail. Once you're stable, you're going home, and all of a sudden the police show up. That's a great, just to show that you are somebody. You're not just a number, or you're a person. So that's just, incredible stuff. The community involvement, being out there. I think that's, for me personally, is what I think is the most important, is actually being seen, going
Absolutely.
to these council meetings, or more than just the council meetings, just going out onto the streets, into the parks, to community centers where the kids are playing, or to the baseball diamonds, where you maybe set up a booth, just say, or where something like that, where they know that you're not just throwing, it's not political season, they want our votes. No,
Exactly.
so what you're doing is incredible, and just so appreciative for uh, for all. And, just with Coach and you spearheading all this, and of course, with, can't forget Heidi.
Yes.
I look forward to doing a lot with you guys. I really would like to get involved more. So please, if there's anything, reach out to us. We will be here usually every 6 weeks. But as I said, I do have our studio in Detroit. For you, Heidi, Coach, anyone with the Brian Cody Brothers and Sisters Foundation, the Hope Dealers, this is now your studio as well, to get the word out there.
Awesome.
Um, Now, for people that need to get a hold of you or Coach or anybody, that everything that we just discussed, what would be the best contact that they could do?
So I would definitely recommend following us on social media.
Mhm.
So my organization is Housatonic Valley Health District. We're HVHDCT, and you can
Mhm.
find us on Instagram. We're on Facebook. We're on LinkedIn as well, and we have a website. And we push a lot of good information out through our website, www.hvhdct.gov.
That is awesome. Well, I tell you what, Amy, I really appreciate you taking the time to kind of bring things to light, that maybe the people don't see that's going on. Because sometimes they feel like it's just, when it comes to anything with political, it's just spitting motion, or spitting, it just, nothing's being done. It's just playing these word games just to, appease people, make them happy. Well, you're living proof that it's not. You and your team are, you're talking the talk, but you're backing up with your actions, and you're saving people's lives. So thank you for that. And again,
Absolutely.
this is your home as well now. So please bring your team on anytime. So until then, thank you guys so much for your support. Remember that addiction is only a word. Addiction is not a death sentence. And if you could please go check us out, support us, go to YouTube, subscribe there, and also over to TikTok and follow us there as well. And until then, just remember, like I said, we're in this together. We are My Fight, Our War. We are a family, and keep fighting the good fight.